So what are the treatments of chronic pancreatitis? Abstinence from alcohol intake is essential. See, alcohol is the mother of all evils. So completely stop it. Abstinence from alcohol intake is essential, important. You must stop alcohol. And then we have conservative treatment. And also we have surgery. So there are two types of treatment, conservative and surgery. Conservative treatment is adopted for majority of the cases. So for most of the patients, we prefer conservative treatment for chronic pancreatitis and not go for surgery. So how do we do this? We have to control pain, control of pain by analgesics. Which type of analgesics? Non-opiate. Why? Because to avoid addiction. Opiate can cause addiction, so we do not want addiction in our patients. We give them non-opiate analgesics. Low-fat diet with oral supplementation of fat-soluble vitamins. So tell your patient not to eat meals with high fat. Okay, so low-fat diet is important. Also give oral supplementation of fat-soluble vitamins. Because since you are not having fat in your diet now, you need oral supplementation of vitamins which are fat soluble. And then correction of malabsorption by intake of pancreatic enzyme tablets with meals. So we know that malabsorption was a great problem. It's one of the clinical features. Because why? Because this patient has loss of enzymes which produces steatorrhea in one of the, like in 1/3 of the patients. And also that malabsorption caused loss of weight and weakness. And also like greasy, foul-smelling stool. So what do we have to do here? Like the treatment of malabsorption is by intake of pancreatic enzyme. We need enzyme tablets, which you will take with meals. So malabsorption has to be treated. First is the control of pain. That is the symptomatic treatment, right? And then the dietary changes. And then we will treat one of the clinical features, one of the symptoms, which is malabsorption, right? And also there was another problem, which is diabetes mellitus. That happens after your pancreas are extensively damaged. So we have to treat that as well by controlling diabetes by insulin therapy. So that's it. This is the conservative treatment. So what if our patient needs surgery? So surgery is indicated in what all the situations? We have to know that. Surgery is indicated for persistent, uncontrolled pain. If the patient is suffering from pain which is like uncontrolled too much, we go for surgery. Options are, first is resection. Resection of part of the pancreas is done only when the pancreas is severely damaged. And rest of the organ is relatively healthy. So like it's only a part, okay? We will cut the part and get rid of it, of that part. Not the entire organ itself, because then other parts of the organ are relatively healthy. So then why would we do resection of like removal of entire organ? We don't do that. We just do resection of a part of the pancreas which is severely damaged. Secondly, we can drain one of the dilated pancreatic duct by pancreatojejunostomy. Pancreatojejunostomy. This by this procedure we can drain the pancreatic duct that has been dilated. And the third is celiac block interrupts the pain pathways from the pancreas and relieves pain of chronic pancreatitis. See, in chronic pancreatitis, one of the biggest problem is the pain. As I said about the clinical feature, the pain is like so severe, or maybe mild in some patients, or maybe continuous or interrupted, that patients take a lot of analgesics and they become addicted. So pain is a problem here. So we can get our patient relieved from this pain. How? We can block the celiac trunk, right? The celiac. So celiac block interrupts the pain pathways from the pancreas and give relief of the chronic pancreatitis patient. So the surgery, in that we resect a part of pancreas, we drain a dilated duct, pancreatic duct, and then we relieve the pain by celiac block. Done. That's all about the treatment of chronic pancreatitis.